Cancer is undoubtedly the disease that triggers or generates the most fear. And rightfully so. It's a devastating disease. It is, of course, we all know, a life-threatening disease. Now, put cancer in perspective, I think there's a few points to take into consideration. Number one, when we talk about cancer, we often talk about genetics, and genetics do play a role. But the National Cancer Institute in the United States has suggested the genetic plays at maximum a 13 to 15% role, which means that 87 to 85% of the factors involved in the development or the triggering of cancer are factors that are environmental, that are dietary, that are lifestyle-based, and they can be controlled. The other point I want to highlight is we are seeing cancer developing younger and younger. More and more women developing breast cancer at younger and younger ages. We used to hear about it in the 70s and in the 60s, 10, 15 years ago, 20 years ago, and now we see young women in their 40s and 50s developing cancer, and it's true virtually of all cancers. Nutrition has a major role to play in a variety of ways when it comes to cancer. Number one is in stopping the initiation or the triggering of cancer cells. Number two, nutrition has a role to play in actually stopping cancer cells from developing or stopping them from mutating or changing and going elsewhere in the body. Now, from a nutritional point of view, we get a lot of patients who are sent by oncologists and physicians, and our objective isn't to treat their cancer. Our objective is to make sure that while they're going through the treatment, they do not have a lot of the side effects of chemo or radiation. The other is to make sure that once they are treated, they don't have a false sense of security. They realize they have to work on their lifestyle, and they have the tools to be able to prevent a recurrence of cancer. And in those who don't have cancer, who may have predisposing genes, well, it's to help the body deal with potential genes by controlling those factors that are controllable and making sure that that cancer will not become a reality.